So there has been a lot of progress in the last 5 to 10 years, particularly in some of the things called immunoassay development and ultrasensitive immunoassays. So previously, a lot of research focused on blood because that was the most accessible biofluid. But because we've now normalized lumbar punctures in the HD field, we're finding new biomarkers, two in particular, the mutant huntingtin protein itself in CSF, as well as a biomarker called neurofilament light, which can be measured now in blood as well. It's a protein that is found in neurons, and when it's released after damage, it gets released into spinal fluid and subsequently into blood, which we can measure now with the more sensitive technologies. Both of these biomarkers have been very important for the field and are telling us different things. So I mentioned mutant huntingtin is a really important target engagement marker for these therapies trying to lower huntingtin. And neurofilament light seems to be a very robust biomarker of disease progression in HD. It's been found to be predictive or prognostic of subsequent atrophy, brain atrophy, and onset of symptoms. It changes very early in disease. There's been a number of multiple studies now that have shown it seems to be some of the earliest detectable changes, potentially up to 24 years from predicted onset, because we can look at people in Huntington's that have the gene and definitely will get it. We can kind of look at them very, very far from onset and do quite interesting research. I think with these exciting results for mutant Huntington and NfL, the big need in the field now is to get a lot more research and a lot more data on these biomarkers across the entire span of HD. This will be really needed for characterizing how these change in the natural history of HD, so that we can better apply them to clinical trials and understand how they change in response to a drug per se, or, for example, using them as tools for enriching trials and stratifying patients, particularly if we want to start looking at patients far from onset, which I believe will be really the way forward for disease modification in Huntington's disease. I think we need to treat people before they have symptoms, and that will hopefully have the biggest impact of potentially delaying onset of HD hopefully ever happening once we have better drug.